Welcome to Notable Perspectives. I'm your host, Dr. Muthu Elegappan, and today I'm excited to be joined by Mona Baset. Mona serves as the Vice President of Digital Services at Intermountain Health, where she leads digital engagement strategy and transformation, including the development and implementation of the overall digital technology roadmap. Prior to Intermountain, Mona held leadership positions in marketing and technology at Atrium Health and Bank of America. Welcome to the show, Mona. We're really excited to have you on.
Thank you for having me. I'm excited.
So I want to jump right in, and you've had a very interesting career spanning both financial services as well as healthcare. What motivated the transition to healthcare? How did you first get into this space?
It's interesting. I actually started out in healthcare way back in the day. My first corporate job was in healthcare at a small employee absence management company. And I was there for a few years and then moved into financial services for almost a decade. And at that point, I really wanted to make a transition into an industry that I really felt was so meaningful, so personal, and made just an incredible impact on the community. I think financial services absolutely does that in many ways, but there's a big difference in not for profit healthcare. And I just felt like the mission aligned with my values and where I wanted to focus my efforts.
So people often talk about how healthcare lags other industries in terms of consumer technology adoption. From your perspective, as someone who has lived in both the worlds of financial services and healthcare, did you find that to be true, that healthcare sort of lacked on the consumer side or is lagging behind?
Well, after spending almost a decade in financial services and then going back into healthcare, I definitely saw a lag at that time, and that was quite a few years ago. And it was almost a sense of deja vu. I was having the same conversations that I'd been having in financial services, but many years prior. And so it was, I guess, comforting that it was familiar conversation and we knew where to go. But we're definitely lagging at the time. I think COVID had certainly accelerated just consumerism and the focus on it. We really had no choice as health systems. So we introduced a lot of new technologies and capabilities quite quickly. I think there's still a ways to go and really focusing on making those experiences just as great as experiences people have in other industries like retail and banking.
At Intermountain Health, when you're looking for inspiration on sort of what does best in class look like for consumer technology, are you more so looking at other industries or looking within healthcare at other systems, other providers for sort of what does great look like?
I think there's definitely health systems that are doing very interesting things. We're leading the way in some of those areas. I do think as far as inspiration goes, I still tend to look at some of those other industries. So if you think about some of the simplest, easiest experiences like Amazon, everybody talked about Amazon. There's a reason why we always talk about Amazon because it is very easy. When's the last time you had to call someone at Amazon? I mean, can you? I don't even know if you can, or live chat or anything. It is just such a simple, intuitive experience. And you look at all of the introductions of new capabilities within the app and that shopping and search shopping purchasing experience, and they're just so intuitive. You don't have to go through training or check out some tips document or phone a friend. It's just so easy, and I think we're not there yet in the healthcare industry. And I think we should continue to look at some of these experiences that have been really the foundation of the success of some of these other companies outside of our industry.
To play devil's advocate a bit on that one, there are those who would say, I mean, the Amazon consumer experience is a far simpler one to solve. I mean, there are items with a fixed price that is agreed upon, and it's a simple two-party transaction. Whereas in healthcare, of course, you've got third-party payers. You don't even know what the service is till you're actually with the clinician, and they may change the service or the CPT code depending on what they're doing. You've got multiple specialties with requirements and prerequisites and authorizations, and like there is a level of complexity that is probably orders of magnitude higher. So is that the right inspiration? Would love to hear your thoughts on that point.
You are definitely right about that complexity. But I think that we owe it to our consumers, our patients, our members to get rid of that complexity or hide it. They don't need to see that. So let's look at some of the basic jobs or tasks that have to be done by a consumer wherever they are. So they have to know how to find what they're trying to purchase. They have to get some good information about whether they should purchase this thing or this other thing. Once they decide, they have to easily select when they want that thing delivered or when they want that appointment. And then it has to be a one-click experience. I mean, I think about Amazon as one click. We're not close to that, but an easy experience to actually fulfill that that task or that job. So I do think we should force ourselves to look at the interaction points as being as simple as possible and as simple as they need to be.
I love that you said, maybe we just hide it, right? The complexity may not go away, but it shouldn't affect the patient experience. And sort of that the complexity is our problem on sort of the provider side to solve, and not something that we have to sort of expose to the patient in the same way. So, one part of it is knowing what to do. And we talked a little bit about inspiration and sort of what does the right answer look like for consumer technology in healthcare. The other part of this is actually being able to execute on that. And so I'd love to get your perspective on um, how are these decisions made at a system like Intermountain Health in terms of what should we build, and then how do you actually go about making that a reality? And if you have time, how does that compare to how it worked at Bank of America or financial services in general?
So I think that at Intermountain Health, the wonderful thing that we have here is that focus on the consumer and the caregiver as well. And so from the very top of our organization, we are all aligned to very specific fundamentals and KPIs. And there are a few of them that focus squarely on the consumer and squarely on caregivers. And this year, those items actually increased in weighting. So they became even more important than some of the other items, which are still important. And so I think having that focus and that direction from the very top of the organization and everyone aligned to that is step one. Without that, you really can't move any of these strategies forward if there isn't buy-in and support from the very top of the organization. And then as far as digital engagement and digital strategies are concerned, we work in a complicated environment. We have a large organization. We have many stakeholders that we work with. They're working with us. We're working for them in so many cases. And we have set up a very robust governance process that enables us to focus on what we understand our executive leadership team believes are the boulders for our organization. These are the things we have to accomplish. And as we come up with ideas, as we come up with different strategies, we want to be sure that we're aligning with those boulders because a lot of the little pebbles and sand will often get in the way of some of the big work that has to be done. So, again, we have support from the very top of our organization to be able to focus on that and be able to prioritize things. I will say this organization has no no lack of ideas. There are so many ideas in this organization, which is incredible. And how do you determine which are going to be prioritized, which are going to be implemented now, which we might have to wait for until later, and the ones that we couldn't do at all?
Yeah. Now I'm intrigued. How do you determine with a sea of ideas, many of them great ideas, I'm sure, what you prioritize?
We look at a lot of things. We look at the level of impact. We look at the resources required to do something. We look long term. So, is this something that is going to help us build a foundation for the future? Is this something that we just do because it has a great impact, requires few resources? Let's just do it. So there's a few things we do there. And in our governance structure, we have a digital steering committee and we have several subcommittees that sit under that with people representing all areas of our organization, our regions, our different service lines, different clinical shared services. And they really understand what is going to make the big difference for our patients, for our caregivers, for our consumers. So it's definitely a balancing act, but we have a lot of smart, creative people involved in the process, and we seem to get it right most of the time.
That's fantastic. And so I love this concept of boulders sort of as kind of what you align to and strive toward. And let's say there are ideas that rise to the top that are aligned with pushing these boulders forward. How do you make the decision on when you're going to build something and invest your own sort of people resources toward it versus partnering with an organization versus licensing or buying? How does that decision process unfold?
So I would say there's another thing we sort of look at, and that is, can this be done with our existing platforms, with our existing partners? So that's first, because I really believe that if we can, again, simplify that whole ecosystem of different tools, different platforms, different partners, if we can simplify that, we will do better for our patients and we'll do better for our caregivers. So that's the first stop. Then we look at what we're trying to accomplish. Do we have even the in-house resources or expertise to do something? How long will it take to do it? How much will it cost to do it? And we'll have to balance some of those things. There are certainly tools and platforms that we have built internally, and it has made sense to do it that way. But there are other ones where it just doesn't make sense for us to have to build out a team with a new set of expertise. If you look at, some very specialized partners and specialized vendors, I mean, this is their 100% focus. And they put the research and development time and resources into these products. And can we recreate that? In many cases, we cannot. And so at that point, we will partner.
I want to switch gears a little bit and hear more about your, you have a terrific background in design thinking, which has become a very popular concept over the last, 1 to 2 decades. As you're thinking about sort of designing these consumer experiences, how much are you leveraging design thinking and what sort of design thinking principles do you lean on the most?
Well, I adore design thinking. And I was first introduced to design thinking when I was in financial services and really was able to see how that approach allows you to uncover needs that you didn't know about, that your consumers didn't even know about, and deliver things that uh, are relevant and effective to consumers. So at that point, I really tried to learn as much as I could about that process. This is in the early 2000s from the very beginning, and tried to figure out how we could uh, put this in place in all the places that I have worked. Intermountain Health, I'm happy to say, also has a very big focus on the design thinking methodology. And my partner organization, the Consumer Experience organization, relies on design thinking for many projects and advancing a lot of different ideas. It works because it doesn't come with any assumptions. And I think we all come to the table with assumptions and we think something is true. But when we actually watch somebody go about their day trying to accomplish a particular task, we notice things that we never would have noticed before. And we notice things that could not really be captured even in a survey process, for example. And so it's such a rich, it creates such a rich collection of inputs that you can really work from. So I am a big fan. I think it is extremely effective for those problems that seem impossible to solve or have sat around being unsolved for quite some time.
That's great. I spent time at Stanford. Design thinking was a big deal there with IDEO and the D School. And
Yes.
I'd love for you to sort of give us some concrete examples on how do you actually practice this, or do you all spend time with patients in these observation sort of exercises? Is there a big room somewhere at Intermountain with colorful Post-it notes everywhere? Like, what does this look like?
Yeah, we do spend a lot of time with it. I think post COVID, the big rooms with colorful post-its are far and few in between now. But we do end up getting together for certain projects as we can. But we've used it in lots of different ways, and I would also stress that in some cases it's just the simplest things. Sometimes I am just wondering about a particular experience that's in place, something very simple. Like, for example, we had an element in our patient portal where there was a document or actually information that people could click through and see. And if they wanted to print it, they could also print it. But the link in the portal said print. And it's just a simple question that I asked. And I said, why do we have a print there? Are we encouraging people to print this? Do they have to print this? Wouldn't they know that they just click into this thing and look at it? And if they want to print it, they can print it. And so I got a lot of pushback from my team. And I said, you know what? Let's just test it. And so we had people go through it and we watched them go through it and we, asked them questions along the way, something very simple like this. And it turns out that people actually wanted it to say view and print, view or print, because it wasn't that obvious. And so things that might seem obvious to us, even though we're patients too and we're consumers too, I feel like watching people go through a process and talking it through it with them or watching them and just getting feedback helped us make that decision. And again, it didn't take very long for us to test this at all. But it's just those little things that will all add up to this great experience or not a great experience. Um, Another example that I'll bring up is actually at a previous organization. We were really trying to. Well, our hypothesis was that we could give our phone agents some better tools where they could engage with patients who called us a little more effectively, but everybody was satisfied with how they were working things. And they said, yeah, it's complicated, but we know how to do it. And so they had like two screens up, sticky notes everywhere, spreadsheets sitting on their desks, and two, three, four systems to toggle in between. And so we asked to just sit with some of the agents for a couple of hours and just watch them do their work and listen in on the phone calls. And I tell this story a lot because it was very telling. It was very poignant. I was sitting with an agent and she received a phone call from a patient, and the patient said, I need to reschedule my appointment. I'm really sorry I missed it. And so while the patient is talking, I see the agent toggling between three, four different places, copying and pasting the phone number in one system, trying to find who that patient is, copying, pasting, putting another one, just trying to find this patient while this patient is talking. And the next thing the patient said was, the reason why I missed my appointment was because my grandson was shot and killed last night. And the agent was very busy toggling and cutting and pasting that she didn't really hear what the patient said. And she said, okay, great. Well, let's just get that rescheduled.
Hmm.
It was not this agent's fault. We did not give her the tools to be able to serve that patient adequately. And it was an opportunity for us to be able to create and grow a relationship with a patient, but instead it really was the opposite that happened. So that's another thing that, again, I think if we had just made some assumptions about what was needed or what was not needed, we would have made a mistake.
Yeah, that's a powerful example. And as a clinician, I've seen that all the time. The words, the experience, the empathy makes all the difference. Now, from the healthcare technology side, how do you measure the ROI of something like that, right? Because there are those that would say, you know, how do you quantify the impact of being present, of listening to the patient in that example and sort of empathizing with where, what they were dealing with? And is our focus on ROI sometimes getting in the way of solving for these types of emotions and experiences?
Such a great question. And I struggle with this a lot because I do think that in many of these cases, to me, these are foundational technologies and they're needed to be able to provide these experiences that are top notch, that people appreciate, that's easy for our patients, easy for our caregivers. To me, they're foundational. They're also very expensive, and when we come to the table and ask for funding for these projects, the soft savings are usually not enough alone to be able to get approvals for these projects. So, as we look at what the impact is, yes, there are many, many soft savings. There's savings in caregiver time, there's improvements in patient satisfaction, and many more like that. But if we really dig a little bit deeper, we can see that some of these things truly impact us from a revenue standpoint as well. So if you're doing the right thing for the consumer and for the caregiver from an experience standpoint, you're going to get the hard benefits too. So if you think about, for example, if an agent has a unified desktop where they know about this patient when the patient calls in. For one thing, they also noticed that this patient hasn't been in for their physical and their kids are also delayed. So, can we get those scheduled for you also? Great for the health of the patient, also ensures that those appointments are scheduled and are brought into our health system instead of maybe going to another health system, for example, or not being done at all, being completely forgotten. So you can look at things like that as well that really do have a hard return. So I think it's a combination, and I think we do have to be disciplined in understanding the hard and soft savings.
It makes a lot of sense. And I think the challenge is often, I think you're pointing out correctly that there is a connection between improving the patient experience and then the hard ROI, whether that's retention or patients uh, not reducing leakage or turnover, or any of those things. But it's difficult to attribute, and there are confounders, and there are things in the middle that could also be affecting that relationship, and that's what sort of makes that equation hard. But on the other side, if we don't account for those things, then we end up a few years from now asking, oh, why is the patient experience or staff experience so broken? And it's, well, it's hard to measure and it's hard to attach dollars to. So
I agree. I do think that we have to see experience as a differentiator because where we are now, and we talked about other industries that have amazing experiences, and people are expecting those same experiences wherever they go, even in healthcare. And if we can't deliver that, they will easily just dump us and go somewhere else. So there's research out there where it's very obvious that if somebody doesn't have a good experience with a health system, and I'm talking about a customer service experience, they will find another health system or another provider that will be able to give them a great experience. There's just not a lot of leeway anymore.
You gave this example of a unified desktop, for example, for an agent, right? Or, because that sounds great. Or one tap sort of check in. All of that sounds fantastic. What is the time horizon in which a system like Intermountain or any of these large healthcare systems, what is the time horizon by which you want something like that to be a reality for that to be considered successful? Is it a month, a year, 10 years? And I ask because in other industries, Amazon is trying to improve these things on a few weeks to months time frame, and speed time has a different time is very relative in that sense in healthcare. So how do you all think about the time horizon of these initiatives?
Yeah, I think it just depends on the project. I will tell you that as a health system, we move very, very quickly, and as a technology organization, we move very, very quickly. And when I compare year over year the things that our teams have accomplished compared to some of my colleagues in some other health systems, the list is quite impressive and pretty astounding. And I do think that's related to just the disciplined approach that we take to choosing, first of all, the projects or the initiatives that we're really going to focus on, and just the level of drive and innovation the teams have to get these things complete for our patients and our caregivers for that matter. So we move pretty quickly, I think, in comparison. Um, if you look at someone, a company like Amazon, for example, I think that's a completely different rate of speed, and they have a lot of internal resources that they're also capitalizing on to get some of that stuff done. But we always want to move faster. The faster we can deliver for all our audiences, the better.
When you think about moving quickly and sort of building these initiatives, we talked about sort of partnering where that makes sense or having partners that you work with to accomplish these initiatives. Intermountain probably works with numerous technology partners throughout the organization. In your experience, when you look at all the partners you have, what are the characteristics of your best partners? Like what really makes a partner stand out to you?
I think there's a few things. One is just that innovative approach to solving problems. That's why we work with a lot of smaller companies, in addition to some of the bigger ones. But some of our startup partners, they move really fast, and they are taking ideas and making them reality extremely quickly. So I think that's very important. I think additionally, partners that will almost co-develop with us. We have a lot of really great ideas that we want to implement, and most of our partners are so excited to be able to do that with us, and they end up getting a benefit too because they can deliver that same improvement or same enhancement to their other clients as well. So I think sort of that co-development partnership type approach. And then I think the final thing is understanding where the industry's going. What are those best practices? What are things that we could do better? And not holding back on telling us how we can improve constantly.
So I know, speaking of partners, a lot of them these days are focused on leveraging sort of the latest in artificial intelligence. And so I'd be remiss if I didn't ask you about um, ChatGPT and large language models and the impact that they will sort of have in healthcare. Would love to just hear your overall thoughts on how fast the space is moving and where you see these applications being most impactful in healthcare.
This is my favorite topic as of late. It is a really exciting time for everyone within healthcare, any industry, all of us. I do believe that just generative AI, LLM, all of that is is truly going to be one of the biggest inventions of our lifetimes. And I really see it, people are talking about some pretty simple use cases, and I think it will help people just do their everyday work and their everyday lives just a lot more easily. I mean, you think about today how we just use the internet or how we use email or how we use anything like that. I think it's just going to become so part of our lives that we will just, ask our assistant, our virtual assistant, to just do some things for us, help us with things. Can you answer these emails? I need to put together this PowerPoint. Simple things like that. And then certainly it has the limitless opportunities for more disciplined and very complex types of automations, I think. You think about, how much research can be done and consolidated to help us, figure out better ways to do things. You think about even things that we're doing today, like clinical documentation. Where can we take that? Um, just making everyone's lives much easier. And I see all of these things as not eliminating people's jobs, but really elevating the work that everybody gets to do. So maybe you might not have to do all these mundane things anymore. You can elevate your work into areas that are more interesting and more valuable. So I'm very excited about the opportunities. I am blown away by how quickly things are moving, and we have jumped in. We're really trying to figure out how to use this new technology in a safe manner. So, for example, I mean, most all this technology is really open source, and so we don't want our caregivers to go out and use these technologies and inadvertently share confidential information. So we are actually working internally to build a sandbox area, a safe space where all of our data is protected um, through technology, through agreements, and we can play around with it a little bit to see what we can do with it. And then after we're pretty sure about its low risk safety, then we will open it up to many, many more caregivers to be able to use it. The nice thing about these technologies is that you, depending on the use case, you don't always have to be an expert in that area or in that particular technology. These are going to be just accessible by just about anyone who can think about a way to just devise any way that their work could be made easier, and they can definitely build a model to do that.
Are there one or two sort of anchor use cases that your clinicians or caregivers are using this for? I imagine perhaps kind of documentation, but are there others that your clinical staff are kind of gravitating towards?
Well, they're not using it yet. We're still sort of testing some things in there. So they're not using it yet. But what I like to say is anywhere we have um, just processes that take a long time, that are very manual, are very open to that. I think, certainly we've talked about clinical documentation. It takes a lot of time. So how do we just accelerate that and make it, more useful, allow providers to spend more time with their patients doing the things that they love to do and are trained to do. So there are going to be some amazing possibilities. And I had mentioned that this organization is not short of ideas. And so we're going to have a lot of things that we'll be able to test and play with.
There are many potential downsides to this as well. You called out some of them. One of the fears amongst, workforces in general is, you know, is my job at risk, or sort of will this sort of displace sort of me as a person in my career? And so, how do you think about that sort of sentiment amongst either your employees or just healthcare employees in general, that this is a step towards cognitive work sort of being automated away?
I just think about elevating work. And if there are things that are so mind numbing and so manual that nobody wants to do anyway, why can't we automate those things and then have people work on other more valuable tasks and activities and projects? I see all of these things as helping us, and that's what I like to focus on. I mean, even think back 10 years. There's jobs that were in existence 10 years ago that are not in existence today. And if we look 10 years back, there are jobs today that did not exist 10 years ago. And so I think there's always that balance of, if this manual task goes away, uh, maybe I'm going to learn how to do something a little bit different, and I'm still, going to be gainfully employed and have purpose in my work. But I just don't see this any different as just progression throughout the years. It's just another tool that we get to use to make our jobs better.
I love that mindset, and I think it's a great point that the jobs in history have never been fixed. Jobs have come, jobs have gone, and so eliminating certain types of work doesn't mean that we reduce the number of overall jobs. It just opens up an avenue for new roles, new types of work, prompt engineering, whatever else you want to call it, to potentially
That's right.
emerge and
That's right.
as we sort of embrace the change that's coming. So very exciting stuff. We have time for maybe one or two more kind of quick questions. So maybe to start with, healthcare is a inspiring career, but can be a draining one as well. And so would love to hear, where do you draw inspiration from on a day-to-day basis as you go about this very sort of challenging, high impact work?
Well, first and foremost, we're doing such important work. And I think if that were not the case, it would be easy to get burned out. And I think that's the case in any job. If you don't feel like you're doing something that matters, you're not going to be a very happy person. In healthcare, things are happening. In healthcare, we are delivering care to patients or communities to keep them healthy, to get them well when they're sick. It's probably the most intimate relationship we can have with our community. And it's probably one of the most important relationships. So for me, when I think about what we're doing, it is directly connected to that. I'm not personally seeing patients. My team, we're not personally seeing patients, but the tools and capabilities that we're delivering are helping with that care. And so that's really what keeps me inspired. And additionally, I love to learn. My whole life, I just love to learn new things, uh, be creative, find new solutions, learn how to do something. And in healthcare, I can do that every day. I can learn something new. And I think that helps me do my job well. And it also keeps me motivated because every day I come to work and I don't really know what I'm working on. It's all brand new. It's all a new challenge, a new technology, a new way to do things, and that keeps exciting for me.
And last question, you've been in a lot of leadership roles in your career. What's the best piece of advice you've ever gotten with regards to your career?
It's interesting. I don't know that I would think about it as advice. I love watching what people do, and I observe and take in a lot. And so I've learned a lot of lessons just by watching amazing leaders that I've had around me do their work. And so I've picked up a lot of things there. Um, if I were to think of just a very tactical thing, and it's very simple, but it has worked very well for me, just even from years back. But I had an executive leader that I worked with back in my financial services days, and he was explaining to me how he spends the end of every day kind of getting ready for the next day, and not just thinking about what he's going to do or what's coming up or looking at the meetings, but actually planning out what he's going to accomplish that next day, and scheduling it out, making sure he has time to do that, and then Fridays, looking at, the following full week. And so it's really what I would say, just the discipline of organizing your work. And some people look at that and say, "Oh, well, that's so boring and so uninnovative. Like, how are you supposed to, come up with these creative ideas if everything's just so scheduled?" And I actually schedule time to think about strategy, and I schedule time to think about innovation and where we're going. Because if you don't do that, and if you're not in control of your schedule, it will be filled. It will be filled by lots of different things that may not be as important as some of this other work that has to be done. So I thought that was great advice, and I have used it since.
That's great. Well, thank you so much for joining us and for sharing your insights, Mona. This was an absolute pleasure and appreciate you being on.
Thank you. I enjoyed it.